At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center. Hello, everyone. Happy Monday. Yes, it is time for MedsPLUS Consulting, and I would love to introduce you to my new co-host today. Sitting in for Dr. Pauline. Hey, Dr. Pauline. We have a pharmacy intern from Samford University, McWhorter School of Pharmacy. Kennedy started with us last week, and she'll be with here for a total of 5 weeks. So she's joining us today on our extraordinary topic on GLP-1 medications. Kennedy Shoemaker.
Hi, good afternoon, everyone. Thank you, Dr. Jennifer, for that introduction. I'm excited to kind of hear about this topic as it's something that I see all the time. So I'm excited to dig in.
Exactly. And we kind of had a discussion. We had an event this past Saturday, but I saw a post online, Instagram specifically, where the comedian Monique had posted about GLP-1 medications, making sure everyone is careful. Not to have people force it down your throat. People are eager to lose weight. And one of the things she mentioned was to do your research. So some people don't have the necessary wherewithal or know how to do your research. So as healthcare professions, and the reason Dr. Pauline and I started this platform is because we want to make sure that you're receiving timely, relevant, evidence-based information. And that's what Kennedy and I are going to do here today. So I thought it would be interesting to go back in time to talk about GLP-1s, because one of the first things that I heard was that, oh, these medications are too new. They don't know enough about it. So there again, a lot of people not knowing these medications have been around for a long time. Maybe not as you have heard of them, and we're going to break that down as well. The medications of GLP-1s, you may know them as Ozempic, Wegovy, Mounjaro, Zepbound, semaglutide, or tirzepatide. We're going to take you on a journey of where they started and these medications and where we are now, because the landscape has changed dramatically and so have the risks. So let's go back. GLP-1 medications are not new. Almost 20 years ago, 2005, the very first GLP-1 medication, Byetta, was approved by the FDA. This medication was injected twice a day, and it had a half-life of only 2.4 hours, which means it cleared your system fast. Fast forward 5 years, we have Victoza, otherwise known as liraglutide. It was a game changer because now you go from twice daily injections to once a day injections. And then in 2011, Byetta came out, same medication as Byetta, and in a more extended release formulation. So now in 2011, once weekly instead of twice daily. So we go from 2005 to 2011, where we get to once a day dosing of a GLP-1 injection. Now, Ozempic, or semaglutide, was approved in 2017, 6 years later. Once weekly, even a longer half-life, but we also saw better A1C reduction for people with type 2 diabetes, fewer side effects than the earlier version. 2022, Mounjaro, or tirzepatide, was approved. And this one is really special because it had a dual role. It hit two different hormones or 2 hormone receptors instead of just one. So Kennedy, I'm going to pull you into this conversation because as a pharmacy student, you're looking at clinical trial information, how to assess it, how to interpret. So can you explain how drug delivery or drug discovery leads to better versions over time?
Absolutely. I feel like the majority of pharmacy school is spent teaching you how to look at information and kind of see how far we've come. So pharmaceutical companies, when they develop new medications, they're learning from the old ones and the past ones, what worked, what didn't. So since, you just told us about the history of GLP-1s, scientists figured out how to make little modifications to like a chemical structure, like, for example, adding a fatty acid chain or changing an amino acid or improving the binding in your body. And that made the drug last longer, work more effectively, and cause fewer side effects. So we're really just honing in on how to get better and better and better each time. So it's not that the new drugs are experimental, they're actually improved versions. We've had 2 decades of research, millions of patients' experiences and feedback. So for example, think about it like a smartphone. We have smartphones that come out, seems like every year. It's not that the smartphone is too new to be safe. It's years of improvement and getting thinner screens and smaller screens and the liquid glass screens and all those other fancy things that come with it. It's the same thing with medications. Each time and each generation, it just gets better and better because we learn the ins and outs and what works and what doesn't.
Exactly. Excellent example there. So once again, newer doesn't mean riskier. It means more refined. The newer GLP-1s have better side effect profiles, more convenient dosing, and stronger efficacy data than the older ones. So that's real progress. So taking a look at Wegovy when it was approved for weight loss. By that time, semaglutide, the same medication as Ozempic, but at higher doses, had already been used by millions of people worldwide for diabetes. We had years of safety data. So during that time, 2021, we were in lockdown mode as it related to the pandemic. As we started coming out of the pandemic, people noticed they had started putting on weight. People started to notice how, or doctors too, that Ozempic was causing you to lose weight or the ability to use it for weight loss. 2021 is when Wegovy was approved. So by 2022 and 2023, we had a shortage of medication. People who needed those for diabetes couldn't get them because the demand for weight loss was overwhelming the supply. Pharmacies had waiting lists, people calling every day, calling different pharmacies to try to find it. So during that time, when the shortage happened, the compounding pharmacy industry exploded. When FDA-approved medications are in short supply, compounding pharmacies can legally make similar versions. So I'm going to pause right there. And Kennedy, once again, can you explain a little bit more about compounding means or compounding pharmacies mean for our audience?
For sure, absolutely. I actually am kind of partial. I absolutely love compounding pharmacy. So what it is a pharmacy is taking all of the different ingredients and they're mixing it together to make a customized medication. So that could be for someone who maybe can't take capsules, they can make them into tablets. So compounding pharmacies have a very special role in the medication world. So like Dr. Campbell just said, when we were in short supply of these medications, compounding pharmacies were able to make them. And they have to follow special, guidelines and things. Their oversight is done. It's not like you just have some people just mixing something together and saying, here you go. There's a lot of things that they have to follow. But the compounded version is not the same as an FDA-approved medication. So the FDA-approved medication, like what you pick up in the box at the pharmacy, has gone through the rigorous testing and the clinical trials and all of that. Compounded versions, we can't do that in a couple hours when we get a prescription and then give it to you when you come to pick it up. So it's not gone through the same testing as for safety and effectiveness. A lot of times that's why you see them come in vials where you have to draw up your dose instead of a pre-filled pen like Ozempic or Wegovy that you get from that brand name in the pharmacy.
Right, right. And I will add also, Kennedy, we do have strict standards for pharmacies that do compound. So when you receive the medication, it will have gone through testing as it relates to not being contaminated or to cause harm. So we do want to make sure that, we understand that as well. I wanted to make sure that when we think about Ozempic or Mounjaro, people usually just think about diabetes and weight loss. And it makes sense because that's what has flooded social media, influencers talking about losing weight, different programs or national campaigns, also compounding pharmacies as well. So weight loss and Ozempic, Mounjaro, Wegovy, Zepbound have become synonymous with weight loss. But Kennedy, I want you to kind of talk about coming up next of the timeline of how we have seen that these are just not one-trick medications for weight loss, but actually making improvements in other conditions.
Yeah, absolutely. So we get our first GLP-1 that's for diabetes. Then we get Ozempic approved for diabetes. We see Wegovy come out, higher doses, different indications. Mounjaro, just like you've mentioned about all the different things that you've seen come out, all the advertisements, commercials, everything that you see everywhere. But just last month in January 2025, Ozempic became the only GLP-1 out there that is approved to protect your kidneys in people with diabetes and chronic kidney disease. So not only do you get help with blood sugar protection, you're also getting protection for your heart and your kidneys all in that same medication. And then on the flip side with your Mounjaro and your Zepbound and stuff, Zepbound, which is the weight loss version of Mounjaro, became the first ever medication in December 2024 for obstructive sleep apnea. So it's actually treating the underlying cause and not just the symptoms of sleep apnea, which is usually someone who's on a CPAP machine or some kind of dental device. Those are just treating your symptoms. Zepbound is targeted towards treating the underlying cause. So these medications have made huge improvements of expansion in what they protect, what they treat, what they help with.
Awesome, awesome. And I think that's a lot of times where weight loss drowns out the greatness of GLP-1s. And a lot of times when I'm consulting with patients and if they have type 2 and other chronic conditions, and I don't see a GLP-1 or the doctor hasn't talked to them about that, I do try to help them have that conversation with their physician because the research has shown how it can improve in other conditions, cardioprotective, heart protective, protecting the kidney. So it's very important that we understand all of the things that GLP-1s can do, and also having that conversation with the doctor to see if it's right for you. I don't believe in a broad brush approach. All of us are uniquely made different genetically, and some of us may tolerate better than others. So in the beginning, we were managing the expected side effects of nausea, vomiting, diarrhea, constipation. These are all real, and for some people, they can be very severe. So the FDA-approved medications have clear dosing guidelines to minimize these effects. That's why we start low and increase slowly over weeks or months. Some people may maintain at a certain dose for a couple of months before their increase. Some people may start slow and just titrate up just one dose. But then something started happening and people started doing what I call self-titration, increasing their doses faster than recommended. Now, if you have the injectable pen or the automatic pen, it was a little bit harder to do. But some of those that have had the vials with the syringes, they had the ability to increase their doses faster than recommended or taking higher doses than prescribed, and thinking more equals faster weight loss. What we started to see was people couldn't tolerate the medications at all, severe hydration, unable to eat or drink for days, ending up in the emergency rooms. Now, Kennedy, you've been studying pharmacology. Can you explain why you can't just take more to lose weight faster?
Yes, I myself am guilty of the mindset sometimes if a little is good, then a lot is great. But with these GLP-1 medications, the way that they work, that's not the best approach and the safety profile for you and your body. So the medication itself is slowing down the gastric emptying of your stomach. So food is going to stay in your stomach a lot longer, and that's going to make you feel full longer. And with that happening, it's also affecting your hunger signals in your brain of like, hey, we're actually really not hungry because we're still feeling very full. So when you take too much too fast, it's like you open the floodgates to your body. You're just overwhelming it with so much medication. So instead, you're not just a little nauseous. You can become severely dehydrated. Your digestive system can pretty much just shut down. So you're not drinking anything, you're not eating anything. Sometimes your stomach can develop something that we call gastroparesis. Pretty much it just stops functioning like it's supposed to. So when that happens, it's like if you take an extra vitamin, it is a powerful medication that's multiple systems in your body. Sorry about that.
Hey, we're business. We're getting phone calls. That's great.
And that's why these medications, as you mentioned, should be low and slow and under doctors' supervision and such to make sure that these side effects aren't something else or anything related to underlying stuff, that this is still a safe option for you to continue.
Right. So yes, thank you for sharing that. Low and slow, that's the way to go. So when we talk about research, getting advice, making a decision, we want you to have really good information so that your information is based upon scientific evidence, evidence-based research, making it on good information, not based on someone who doesn't quite know the full story. And yes, when you hear anecdotal information, it's good to hear, but let's make sure we take it back to the doctor to address your concerns, or your pharmacist. Your pharmacist is going to know about those things because we're counseling patients about those things. Here at MedsPLUS, when you start a GLP-1, if you're new to it, you're going to receive individual, comprehensive consultation from us. We're going to talk about how to use the medication, how to take the medication, the best day and time to take the medication. Should you have medication on your stomach? Is it okay to do it in the morning? Is it okay to do it at night? What does a meal look like for you now that your appetite has been decreased? So that's very important to get that information. In the physician's office, there may not be time for that or limited time. And that's where we fill in the gap to make sure you're comfortable with taking the medication, you're doing it correctly, and how to manage if you have side effects. Is it time to go up on the next dose, or should you wait another month? So all of that is very important to receive the great benefits that we've just described from the GLP-1 medication if it's right for you. So we talked about the beginning 20 years ago, what has happened in between. So where are we right now? So right now, just last month, I'm sorry, December 2025, we're in March now. The FDA approved something that's going to change the game again, the Wegovy pill. This is the first oral GLP-1 medication approved specifically for weight loss. It's a 25 milligram once daily pill, and in clinical trials, people lost an average of 16.6% of their body weight over 64 weeks or a little over a year when they stayed on the treatment. And that's similar to the injectable version. So it began launching in January 2026, starting at $149 per month. And the competitor is expected to release a GLP-1 pill form as well later this year. So now, later this year, we could have up to 2 different weight loss options for that. Now, some of you that already know may be thinking about Rybelsus. Rybelsus, already a semaglutide pill, is out there. So you may be asking, what's the difference? Excellent question. Rybelsus has been around since 2019, and it is an oral semaglutide pill, but here's what you need to know. Rybelsus and Wegovy pill are not the same product. Rybelsus is approved for diabetes management. It tops out at 14 milligrams daily. And at that dose, people see an average weight loss of about 4 to 6% of their body weight. Wegovy pill is approved for weight loss and cardiovascular risk reduction, and it goes up to 25 milligrams. So that's the difference there. Okay, so when we talk about where we've come from, where we are, first step, number 1, talk to a healthcare provider, pharmacist, nurse practitioner, physician's assistants, your PCP, your cardiologist. Get a full evaluation, blood work, medical history, assessment of whether this is truly appropriate for you. And Kennedy, if you'll take number 2.
Absolutely. So what's really important with this is that you only get these medications from a legitimate licensed pharmacy or your doctor's office. The FDA put out a thing warning against counterfeit products that are out there on the market. So it's really important to get it from a legitimate trusted source like your licensed pharmacy or doctor's office. And if someone's offering you a GLP-1 much, much cheaper than retail price, it's probably too good to be true. So don't ignore that red flag waving. Do your due diligence on it, because counterfeit medications are out there and they can actually be very dangerous for you.
And that's a great point to note. MedsPLUS, as a licensed pharmacy, we make sure we fully vet every medication that we have, that we dispense, that is prescribed by your doctor. So yes, we have done that vetting process for you. Thirdly, we want to make sure you follow the dosing schedule exactly as prescribed. And as we said before, slow and steady is the way to go to minimize those side effects.
Absolutely. So number 4 here is also keep in mind that these medications are not a magic bullet. It's not a wonder drug that's going to fix everything. They are effective and they work when you're also combining it with lifestyle changes. So nutrition, physical activity, behavior modifications, like if you're a stress eater, things like that, that's what make these as effective as they can be. It's not, okay, well, I'm just going to take the medication and let it do its magic. You got to kind of put in a little bit of work too. So studies show that people who just up and stop taking the medication, but they don't actually maintain those changes of nutrition and physical activity, are actually going to regain the weight. So why put in all this hard work to then stop and have it come back? So you want to get the best bang for your buck, as I like to say.
And that's a great point, Kennedy, because the question we get asked a lot is, do I have to stay on this the rest of my life? Well, it depends. Are you taking it for type 2 diabetes? And then, as you mentioned, for weight loss, are you putting in the necessary work? Because consistency is not going to stay there unless the lifestyle change is met, of those items that you just described. So there are what has been seen to work or does work are the maintenance, where it may not be once a week. So there are different things that are out there now. So definitely talking with your doctor or pharmacist, we definitely can explain more about that as well. Last but not least, making sure you take note of your side effects, what's happening, what's changing, and making sure that you are letting your doctor or pharmacist know there are things that we can do or tweaks that can be made to help improve. And then over time, as the body adjusts, you could actually have success, or it may be you need another medication. So there are different options that are out there. GLP-1s are not the end all be all. They are very great at what they do, but we have to remember they are not for everyone. If you have a certain medical condition, if you have a history of medullary thyroid cancers, there are some absolutes that you cannot have a GLP-1. That's why the pre-assessment is so important. So things to remember, we've come a long way from the early days of GLP-1. We've gone from shortages to new products, injections to pills, from limited access to widespread availability. One caveat I'll add here as it relates to access. In the beginning, GLP-1s were very cost prohibitive or very expensive for people that didn't have insurance, if they couldn't afford other types of coverage, and having the compounding version did allow access. And I definitely like that part of compounding pharmacy, that it can be more affordable. And that's why getting it through a trusted pharmacy, we're going to do the vetting process for you. If you're interested in a GLP-1, reach out to us, 205-650-4636. You can reach us in the comments of this, or you can message us directly, or you can go to our website to set up a consultation, and that's MedsPLUSconsulting.com. So before we end, we do want to let the public know that Dr. Pauline, let me share what we got here. Okay. All right, there she is, Dr. Pauline Long. She's protecting vision, serving the community, and she is now booking community and church presentations. We actually did a joint presentation this past Saturday. It was great. The audience was very engaged, had great comments, questions, etc. But Dr. Pauline wants to get booked and busy. So you guys reach out to us and let us know if you would like to have her come out and talk to your group, church group, community group. Dr. Pauline is a certified master trainer with American Diabetes Association, or ADA. So we want to make sure we get her busy. All right. Thank you all so much for tuning in. Remember, GLP-1s are great if they're at the right dose, the right person, and you've had the proper education around what you need to do to make the effects life-sustaining for you. Thank you for tuning in to MedsPLUS Medical Minute. You all have an awesome day. Get you some sunshine and have a great week.
Thanks, everybody.
Thank you, Kennedy.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.